Aloha, malolele, and welcome to the Let's Talanoa podcast. I'm your host, Kepu, and today we have a very special guest, Roman Madsen. But before we get into that, just real quick, I just want to let you guys know that I started experimenting with our logo, and we have it here on t-shirts. I'm working on getting more and seeing what we can do with it. Potentially, we could do a scholarship fund with the t-shirts and the profits from all of it, but that's still in the works. Just wanted to let you guys know that this is what it's going to look like if it's on a t-shirt. We'll see what more we can do with that. But yeah, back to our guests. Welcome, Roman. Thank you for taking the time to be here.
Thank you, Kepu. I appreciate it.
No problem. Like I've been trying so hard to get someone in your medical field to talk about this. This is a popular demand topic from our listeners and from people on social media. So I'm super grateful that you took the time out of your day to do this with us. And I'm going to let you introduce yourself, talk a little bit about your experience in mental health and your job and anything you want to tell us more about your journey with that.
Okay, awesome. Well, first off, I just want to say aloha. And I'm excited to, would it be correct to say we're gonna Talanoa?
Yeah.
Or how would you say?
That's perfect.
Yeah. This is awesome what you're doing, Kepu. I love it. And I'm so excited that I get to be a part of it and that you honored that you would invite me on here to interview. And I really hope that we get this out to a lot of people and that people will share this, because I think it will help us out a bunch, all of us together. Because one of the biggest things, well, I'm a physician assistant in psychiatry. So I treat anything from generalized anxiety and depression to court-ordered treatment, schizophrenia, and bipolar disorder. So as far as mental health challenges come, there's really nothing that you could throw at me that I probably haven't seen before. And one of the biggest things that I've been learning is it takes a community to help all of us out, and one person can't do enough to help people out. So as we educate ourselves, we all can help each other out. And I think that's a huge part of what you do, is learning about others and sharing that with other people so that we all can, thrive in our lives. So to give you just a quick background story of me, so you can kind of see how I got to where I'm at now and the way that I treat people or help people, you can understand it a little bit better if I give you a little bit of background. So around 14 years old, I was obsessed with self-help books. Anything I could get, I loved learning about how to better my life. I don't know why I gravitated so much towards self-help, but loved it. Then I served an LDS mission for the Church of Jesus Christ of Latter-day Saints as a volunteer missionary in Mexico City. And that just opened my mind completely to a new culture, learning their language. And I dove into the culture. In fact, I did a 6-month fast with no English so that I could really learn the language. Wow. Because it was really important to me to connect with the people. And man, did I do that. The people in Mexico City will always have a big part of my heart. In fact, around Christmas time, I get homesick for Mexico because the people are amazing, the food, the culture, everything about it. So it all of a sudden made me realize there's more to this world than the United States. And it also opened up my eyes that I'm taught a certain way in the United States, but it's just one story of this world. And every single culture has their story and they have how they view it. And the best way to fully understand it is to get it from more perspective, from more people. So that really opened up my mind, which really helped me down the road. Because I kind of, looking back, I can see why I'm able to connect with people and make a lot of good progress with people because of where I've come from. So then I was super fascinated in the human body. Physiology, anatomy, and so I decided to go into become a physician assistant, and I did my schooling in Oregon, beautiful Oregon, and became a physician assistant. And then mental health had always been kind of something that I was interested in. And so ever since I graduated, I've been working in mental health care. And it's, I'm coming up on 6 years that I've been working with my same company, Horizon Health and Wellness. And they have been amazing to be able to give me a lot of flexibility to be able to really treat my patients the way that I want to treat them. And so then it brings me to now where I've been in mental health care for 5 or 6 years, but I'm starting to realize that our traditional system that we have right now, there's some more that can be done in how we treat mental health. And what I mean by that is our healthcare system is just a tool and should just be used as that, that someone comes to see me and they're using me as a tool, but I am not, the way that they will fix everything in their life. They have to come to me, and the first thing I help them understand is we got to find out where your focus is in life and what you want to create in your life, and then I can help you help yourself get there. So some of the questions you'll ask me, we'll be able to kind of talk about maybe some of the specifics in mental health care and different things, or in mental health in general. And we can go there, but I just want to give a little bit of my background so you know where I'm coming from. But I am very much now taking a holistic approach on health, your physical and mental wellness, being nutrition, kinetic movement, and mental health strengthening, just the complete picture. In order to, I always tell my patients, I'm not in the business of trying to get people to feel less crappy. I want to help people thrive. That's what I want to do. This life is supposed to be fun and amazing. Doesn't mean that there's not challenges, but right. You enjoy the journey. You get through those challenges, but you always have your focus out ahead of you on what you're trying to create in life. And everyone can learn to thrive in, measuring up against themselves, because that's where progress is with the individual and what they can improve with themselves, and not comparing them to someone else, but let's take an individual and let's help them thrive in their way.
Wow. Thank you so much for sharing that. I think I'm super excited for these questions because part of the history of the Let's Start Now podcast, all 5 episodes so far, is that and I don't know if it's too personal to share, but I'm so happy to have you today because of how close the mental health is. And you mentioned stats about that. We were talking about this when we were making a tie the other day. What was the stats about mental health? Is that you gave me some numbers about how.
Oh, so the majority of people that I see, I would say, roughly 8 out of 10 patients that I see have some form of anxiety. It's definitely there. Anxiety is very common nowadays, and it's very common to have a mixture of multiple problems, whether it's depression, so you have a deactivated brain, or whether you have an overly active brain and you're dealing with anxiety, or a combo of both. But mental health is, I don't think it's just, let's say, the media or people blowing mental health out of proportion. I think there's a challenge there. I don't think we should be overwhelmed. I think it should call us to arms and realize, hey, we got a challenge, so we got to find some solutions. And I think we definitely can. But I think the pandemic just really, you think of all the experiences we were having and being out in the world, and then everything was shut off. And so the part of our brain that's stimulated as we go out and live our lives shut down. And then some people that were dealing with maybe depression and anxiety or other mental health challenges, that just got worse, because a lot of anxiety and fear grows as you avoid it. And for once in their life, they were told, hey, stay at home. That's a good thing right now, because we need to be safe from the virus. And so then it's like a whole year that people stopped going out. And so that anxiety grew, and the fear pulled in from COVID, and people not going out and stimulating their brain through experience, through social interaction, face to face. I mean, we're stimulating our brains different ways. There's a lot of good that came from COVID, believe it or not. But with that, it's also, there's the flip side of the coin. And so, but I think COVID really has amplified a lot of these challenges in our mental health. And so it's awesome that everyone realizes that, and everyone's kind of starting to talk about mental health more. Like some of the mainstream Netflix and Amazon Prime, they're starting to put out videos on mental health, and some of them are really good. And I think it's really bringing mainstream to help us kind of see that this isn't taboo. We don't need to be scared to talk about it. We just need to talk about it in a positive way, and in a way that we're going to move forward with it. It's all right to talk about anxiety and depression, but that doesn't mean we have to dive to the negative of anxiety and depression. We need to help people understand it, so that then they can work on it and strengthen it, and realize that medication is just a small fraction of helping your mental health. It really is. I would say, if I were to guess, it's like 8 to 10% of the picture as far as what can help someone become, mentally stronger and mentally well.
Yeah, well, that answers some of the questions that I was going to ask. We might get into more detail on that. But yeah, and after what you said, that when we were making Otay last week, or no, it was this week.
It was awesome, by the way, man. I love that. Thank you so much. That was an awesome experience.
No problem. But yeah, part of the history of the Let's Talanoa podcast is that I've been working on it for a very long time. And just all the stuff that led to it, and it became the ultimate, so far, outlet for me to do what I've loved to do, Talanoa with people, and not just have that learning experience for me, but share with other people. But what pushed me to finally, because I had a lot of insecurities about doing this, what if people don't listen to it? What if people listen to it and they are saying negative things? All that whole thing that comes with it. But then I was talking to one of my siblings, and she talked about suicidal thoughts and stuff, and that really, I'm I need to do this. I don't maybe, I don't know, maybe I'll have the effect that I want to, maybe not, but hopefully I'll help someone else, like my sister out there. And that's what gave me the final push to do this podcast. And I'm just so grateful, because you are a pivotal mark in accomplishing one of the original reasons why I wanted to do this. And with that being said,
it's funny how that works out, right, Kepu? It's
right.
Funny how things all just come together, and that me and you were able to connect in this way. We met how many years ago? I mean, I probably maybe had heard about you or met you through our family, but really when we came out to live here and we really got to know each other, everything happens for a reason, right?
Yeah, it's funny. Yeah, I met, and I knew that you worked in mental health, but it wasn't it didn't really click for me. That you is the best person to talk about it at this point with it. Until we did the Otay thing, and because I have written other therapists, and I know they're busy people. And then when we were doing the thing, I was like, what am I doing? Roman literally does this. I could just ask him. So yeah, it's amazing how things work out. So yeah, with that being said, you were talking about medication. Yeah, our first question for today is from most of these, I think 2 of them are from Caucasian Americans, but most of these are from Polynesians now living here have been living here in the US in the last 3 to 5 years. So they're more aware with mental health and just everything. So the first question,
I mean, how was it? How was it in Tonga as far as mental health? Was that something? Because some cultures, I've come to find that some cultures talk about it more so than other cultures, and some cultures see it differently as other cultures. The mental health, mental aspect of your wellness?
How I've seen it, is definitely something that I think there's some effort, because I remember seeing it in the news. I remember seeing it in TV programs. Did they try to address it? I don't know how well it's going. I don't know how big of a program it is. Um, but yeah, and the government has their struggles and stuff. Everybody knows that, all the government stuff that's happening. And if the government's struggling, then obviously the constituents are struggling too, right?
Mm-hmm.
But it's definitely it's definitely a taboo subject for the most part, because I know and I've seen in my family and in the community, and people suffering. And it could be, sometimes I wonder if it's like they're high functioning autistic kids, or like, and a
Mm-hmm.
lot of times we just like hit them, like physically abuse them, and it's generally accepted in Tonga, right? The physical
Mm-hmm.
punishment. um and just because they won't listen, or they're just being too weird,
Mm-hmm.
or and these are all like, I acknowledge that these are all anecdotals. I don't know the actual empirical data and all of this, but this is what I've seen
Yeah,
with
totally.
mental health, is that I've seen that happen, where they don't understand the children, and a lot of times they're being disobedient. That's the word, talangata in Tongan. Or they won't listen, or fanongo. But I wonder if those kids or adults even are, well, I know, if I were to guess, like there is mental issues there that are not being addressed, but a
Oh
lot
yeah,
of times,
definitely.
yeah, but a lot of
Definitely.
times
And
they're
it's always,
just like when punished. Sorry.
yeah. And a lot of times it's hard because I understand, like I work with a lot of patients where I can almost hear my little kiddo crying out the window. But I definitely, I try to always understand and see both sides of it, because it is very difficult when you have a child that's very difficult to teach, and you can't teach it in just the normal way because maybe understanding is a little delayed and different things. The person really, obviously, we all want what's best for us and others, but sometimes we make mistakes because of how we were taught or our understanding. But it's really hard for parents to take care of these kids. And they, in the beginning, they probably do things, and sometimes they have moments where it's better and they connect better, but they just get frustrated, and they tried to talk to them and they're not listening. So that's what happens sometimes, where you'll hit them, and that actually makes things even worse, because that activates their sympathetic nervous system, and then the kid gets very anxious, and their brain is all of a sudden prepping them for danger, and they're heightened, and it makes things a lot worse. And we can actually take that to our kids as well, that when we talk to them, we have to first get them in a comfortable situation where their brain is not perceiving danger, so that it calms things down so that they can learn. And then you got to ask them questions, and you got to get them thinking. And everyone around needs to kind of always be in a learning type state of mind, so that we can, get things better. But it's hard. It takes a lot of patience. And these parents that have kids that live with them through a lifetime, because of not only their mental health challenges, but intellectual challenges and physiological, impairments. And so it can be hard, but we'll sidetrack a bunch because there's so much in mental health. But going back to your question, so medications, what do you have as far as questions about medications?
The question here, and I think you answered it a little bit, because you said medication is like 8 to 10%. But they said here, is it safe for someone to just take meds and not go to therapy?
So is it safe? Cut and dry, yes, it's safe. As long as you're seeing a professional that understands and is licensed to prescribe medication, yes, they can give you that, but it's not the whole picture. So a lot of times, if you just do that and you don't use therapy, then you're really kind of only putting a Band-Aid on. And the minute you take that medication off, if you haven't really worked on some of the stuff, then it's very possible that a lot of the challenges, mental health challenges, when you come back or when you come off the meds, you'll be just the same, maybe even worse if you're just using medication. So let me, that kind of, I think is a good segment to let people know, at least in the United States, the healthcare system and what you can do to get help. So first you have from least aggressive to very aggressive.
Okay.
So least aggressive would be, self-help, using YouTube, books, watching different stuff to help kind of deal with maybe a little bit of anxiety and depression. But you feel fully that you're able to control things, but you wish it was a little bit better. So you can start there. Then it might be where you're just really finding roadblocks and you're not able to see your blind spots and you're not getting better with, say, anxiety or depression and different things. And so you maybe want to step it up to talk with a therapist. A therapist, someone that can use different therapy techniques, behavioral, and other different methods, and they can help actually change your brain. Sometimes people think brain changes only through medication, but no, quite the opposite. In therapy, they have research and they show that therapy actually changes the brain when done consistently, and it can help these mental health challenges. But sometimes it needs to be a little bit more aggressive than that, because some people are to the point where they almost can't even work on their mental health because they're so overwhelmed with their challenges that they're getting to the point where they're having suicidal thoughts. They're getting to the point where they can't even leave their house. They can't even go get groceries. They literally are living in fear, and they're so unmotivated that maybe they aren't even doing the acts of daily living. They're not even showering as often because it's getting so severe. I don't know if you ever should just start medication. I think you always, if you're going to do medication, you should always do therapy with it. So you have therapists that are anywhere from, a bachelor's to a doctorate degree therapists, they're training. And then you get into psychiatry, where it's medication. Psychiatrists back in the day used to do a lot of the psychotherapy, so counseling. That's why people are always confused. Wait, are you a psychologist or a psychiatrist? Wait, you're a PA? What? So in psychiatry, you have nurse practitioners, physician assistants, and doctors. Nurse practitioners and physician assistants work in psychiatry. A doctor he does a residency in psychiatry, and he is a psychiatrist, and he has a medical degree, or he can be a doctor of osteopathic medicine and can practice psychiatry as well. But you go and see them nowadays, they do a lot more of explaining the physiology behind it and letting you know your options. Sometimes when people come in and see me, they're like scared that like they have to be on medications or something, and they're coming to see me and they have to be on meds. And I let them know, hey, we're going to talk about it. I'll let you know your options. It might be where maybe we want to just try out therapy, and maybe you won't even need medication. Let's just start there. But you have the option of adding it on. Or, hey, let's add on the medication, but let's also get you hooked up with a therapist so you can be working as this medication starts to help too. But you have to be careful when you come into the mental health care system. Oh, sorry. And so then medication, and then the step higher, if you need a higher level of care and you need inpatient care. So maybe you're at the point where you really think you might act on some of these thoughts. You need to be inpatient, where people can take care of you and make sure you're safe, and be in a hospital setting so that you can be there. They can do therapy, multiple hours in the day. It's, if you get a good situation and a good hospital and good people, a good team, it really can lift you up. But like I said, one thing you have to be careful with mental health care is look at us as mechanics. When you go in and fix your car, some people don't know anything. Like me, for example, I really don't know a lot about cars. And so when I go in to see a mechanic, sometimes I'm like, he could tell me anything and I might just believe it because I have no idea what's going on. But at the same time, sometimes you want a second opinion because this mechanic, maybe he sees something that needs to be fixed, but maybe it doesn't need to be fixed, or maybe there's a different way about going about doing it. And it's like when you come in and see me, you first got to make sure that I'm the type of provider and my mindset and where I want to go with your treatment, you feel good about that. And you feel like I have a healthy perspective and I have a positive mindset. And when you come in and see me, you feel good about adding me to your team. Because when you go to the healthcare system, the one in charge is you. It's not the doctor or me or a nurse practitioner. It is you. And so you come and you use me, give you knowledge, give you some options of different treatment choices, but you choose it. And you let me know kind of what you're thinking, and I'll let you know, oh, hey, yeah, we could do it that way. Here's the pros and cons, or we could do it this way. Be careful, because when you see a therapist and a provider, just because we have a license doesn't mean we're good at what we do. And so you have to be very careful, because sometimes you could get in and see a provider, and we're so overwhelmed right now. The system, there's so much help needed that we don't have a lot of time. And sometimes in the medical field, we lose hope that patients really will do their part. And so we just like, okay, here's a pill. All they want is a pill. So give them the pill and get them out of here.
Makes sense.
They don't want to do anything else, you know, and we get frustrated, but we got to remember, hey, like realistically, people can make changes. You just got to believe in them, and you got to inspire them, and you got to help them. And so be careful when you go into the mental health care system. It's okay to fire us. If you're going and seeing a therapist and you're like, what is going on? Like, we're diving way too deep and staying in the past way too long. I don't feel like I'm moving forward in my therapy. So you know what? I'm going to tell them, let them know, hey, I don't like the direction we're going. Maybe give them a couple tries to maybe go the direction you want to, but then not fire. If you come in and see me and you're just not clicking with me and you just don't agree, fire me, get a second opinion, go get another provider. Don't feel like you're stuck with whoever you go see. There's always options. And so, you know, don't be afraid to fire your provider and get someone else. And those are strong words. It doesn't need to be like a negative connotation, but sometimes you want a different mechanic. You want a second opinion. Maybe you kind of believe the mechanic, but just in case, you want a second opinion so someone can say, oh, you know what? Yeah. I know that guy, and what he's saying actually is pretty spot on. I do the same thing. And then you're like, okay, that makes me feel better.
Right.
Does that make sense?
Yeah, that makes a lot of sense. Thank you so much, because that answers some of the other questions. But on the topic of medication, no, you're fine. But on the topic of medication, what's your opinion on ketamine treatments? I think that's what.
Okay, so ketamine, there's a lot of treatments on the horizon that are somewhat new, but ketamine is very aggressive, and it's a lot of treatment-resistant depression and different things. And so people have tried multiple medications and different things, and then you get to the point where you're kind of like, okay, we're stuck. Someone's not moving forward. They've been on multiple medications. They've failed medications. You know, they're doing therapy. They're just, you know, they're not progressing. And oftentimes it is with depression, and you get those suicidal thoughts, and those suicidal thoughts just don't go away. And so ketamine has been shown to be effective. And again, I am not well experienced with ketamine because I haven't started to prescribe ketamine. I think I've had 1 or 2 patients that I've sent to clinics to talk about. And these are patients that had already tried electroconvulsive therapy, which has changed over the years. But again, that is electrical stimulation. And sometimes there can be side effects with that, memory loss and different things. But with that being said, an alternative to electroconvulsive therapy is ketamine. And then, you know, what else is on the horizon for mental health treatment is marijuana, shrooms, psilocybin, which is magic mushrooms. There's a lot of cutting edge stuff that basically it's a different way of stimulating the brain and releasing different chemicals. But with the ketamine, it can cut back on suicidal thoughts. almost instantly. So that's why it's super powerful and nice. But the thing is, oftentimes if people aren't effectively treating their mental wellness, the ketamine can help, but you almost, once you stop it, if you're not doing some of these other things, you revert back to your challenges, your depression and different things. And it sometimes has to be a maintenance thing. But with specific treatments, it's so personal, and so there's so much that goes into deciding what is appropriate for the person. Yes. There are a lot of vagueness in which medication you can first try. There's different options, but once you get into needing to be a little bit more aggressive, I think that's when it's really important to have the right people on your team to fully inform you of possible risk and possible benefits, but always having a provider that's very open in, knowing what options are out there and being well educated in the different types of treatment, and being able to inform our patients so that they themselves can make the right decision. Hey, Roman, I think I want to do ketamine. How do we go about that? Do you know any clinics that you recommend? What should we do? And then there's different types of ketamine. Now you can do a nose spray, Spravato, and then also you can do infusion, like an injection type thing. And so yeah, there's a lot of promising different types of treatment. And when I say promising, I think the step away from ECT, I don't want to talk down about it, but I don't know if that's the right direction, ECT. I think there's better options out there, but I know I've had patients that have had some benefits from ECT. So again, it's not black and white, and it's on an individual basis. But ketamine, I think it's worth continuing to study and watching, and being aware of always different potential side effects and risks of different medication, and always weighing the pros and cons. Ketamine, I think there's, it intrigues me, and I think there might be some promising benefit from that type of medication. But again, it's only a fraction of helping treatment.
Right.
And also, we always have to put this disclaimer out there, and especially as people start to communicate and chat on your YouTube channel and communicate back and forth. You talked about being scared and always wanting to be kind of positive and that people don't take things the wrong way and stuff like that. I get that. And everyone needs to be aware, if you're ever going to make comments on YouTube channels and stuff, always know what's your focus. You want the end in mind. You want to help people through your comments as well. And so it's all right to have questions and to have opinions, but do it in a way that you're going to take us all positively forward, and that we're not going to hurt someone maybe with misinformation. Or when someone has suicidal thoughts, it's okay to have suicidal thoughts. Don't think of yourself as a bad person because you have suicidal thoughts, and don't get scared of the suicidal thoughts. Be open about it. Talk to people about it. And let's understand where you're at. And if you feel like you're starting to feel like you want to act on these thoughts, or you're, thinking that realistically you might harm yourself, trust me, there's life for everyone out there, and life's worth living. We just need to help you out. And so vocalize this and realize there's certain people out there that will be able to help you. And so don't be able to tell people that you're having suicidal thoughts, and get help through a friend, through a therapist, through a psychiatric provider, or check yourself in if you think you need to. You have options, but don't be quiet about suicidal thoughts. Open up, seek professional help, talk to people. It's okay to have suicidal thoughts, but let's work on showing you that we can help you focus on life and create your physical and mental wellness, and the suicidal thoughts will go away as we effectively treat it. But you don't need to be scared of it, and it's not bad. But let's help you focus, change your focus, and let's help you get over this so that you can thrive.
And it's important that maybe, and you can correct me if I'm wrong on this, for the other side of that, if you're the person listening to someone having suicidal thoughts, that you talk to, the person that's having it talk to the right people, the people that you can trust, or, you know, because there's some people, if you just talk to, they'll be like, I don't know, they may take it the negative way. But that's just this little
Yeah.
disclaimer there that I wanted to put in. Um, there's another question here that kind of relates. There's two of them. How do you know you have mental issues? And how do I know if I'm unwell or have mental health problems? They're two different from two different people, but it kind of relates. And does that go back to kind of what you were talking about the diagnosis chart or spectrum thing?
Yeah. So to know if you, so we have it's called the DSM, and the latest version, we update, and they produce the latest version of basically diagnostic criteria where someone can be diagnosed with a certain mental health disorder. And oftentimes, just because you're diagnosed with a mental health disorder doesn't mean that the treatment has to be a certain way because now you've been diagnosed. So really the question, one of the biggest questions is that you should ask yourself is, am I mentally and physically thriving? If you're not, then you probably need help. But knowing what type of help is very important. And that's going back, hey, if you are excessively worrying and you constantly are seeing worst case scenario and you're feeling your heart race often, you're feeling very exhausted, and you feel like a lot of your day you're almost living in fear, and you see that you just don't seem like you're enjoying life, then something's definitely up and you need help. And if you feel like you're so overwhelmed and you don't even know, what to do, then if you get in to see someone, and remember the whole mechanic analogy and saying, hey, you always get a second opinion. But if you get to the right people, we can help you understand what options and what you might need. Because I might just be able to reaffirm that, hey, I do notice that you have some anxiety symptoms. I also know that I can tell that you really haven't heard a whole lot about anxiety and what different options are out there for treatment apart from medication. And so I think, and I have certain YouTube channels, there's so many amazing people on YouTube and so many incredible people that are, know mental wellness, that aren't a psychiatric PA, that's not a therapist. And so I can direct people and help them and say, hey, look, I want to try, let's try for the next 4 to 6 weeks or maybe a few months. Let's get you hooked up with a therapist. Or, you know what? I think sometimes my friends that I'm not necessarily treating, but they're just asking questions, I'm like, hey, go to this YouTube video and watch this 2 or 3 times a week for the next month and just watch what a difference it makes. And so, the biggest thing is, like you said, Kepu, you got to find the right people. And to answer that person's question, I'd have to talk to them individually and kind of see where they're at. But you don't want to look for a label, because a label can be helpful because it can steer us. But oftentimes, the label sometimes will all of a sudden be an excuse or a crutch. It's like everything that happens in your life is because of your label.
Right.
Like,
so,
I have anxiety. So, when I get asked to talk in front of people, I have anxiety, so I probably shouldn't do that. And it's like, no, that is not the case at all. So, and at the same time, I don't want to downplay anything and say that mental health, people a lot of times will say like, well, people always say mental health's just in your head. I'm like, think about what you just said. What's in your head? Your brain. Your brain is very important. Yes, there's a component. You have your mind and your thoughts, but your brain's important. It's a big deal. So, yep, I would answer and say, yes, it is all in your head. But in your head is like, one of the most important things alive, in your body. And so, yeah, you gotta know that that if you want to thrive, so you got to figure out how to thrive. If you're not thriving, then yes, something's wrong.
Okay.
So, but that doesn't mean that it realistically,
you need medication
that, yeah, exactly. And you, Kepu, and me, like, we're just starting to get on the grasp of this thriving thing. There's still so much more that I need to learn and strengthen. Like, for example, I like to shift it over to mental wellness is not just about people that are really struggling. It's about people that maybe aren't working on their mental wellness because they think they're all right. You don't stop going to the gym when you get a six-pack.
Yeah. You got to maintain.
You got to maintain, and getting a six-pack, the importance of having a six-pack is so that you can do things with your abdominal muscles to further enjoy life. So, like, as you're able to get up quickly to grab a toy for your little baby, or, you know, you're climbing up a coconut tree, you need that core to bring it in so that you can function and do the things that maybe will help you thrive.
And not just for show,
No, exactly. It's functional. I'm all about functionality fitness.
Right.
You know, like, if you want me to give you advice on what you should do for your physical exercise, tell me what you want to do in life, and then I'll help you figure out what you should do physically to strengthen your body. Does that make sense?
Yeah, that makes a lot of sense. I like what you said about earlier about the diagnosis. Just because you're diagnosed doesn't mean you have to I forgot what you said, but it was so good that, like, just because you're diagnosed by the doctor doesn't mean that you have to live by that label. Just because you're diagnosed by anxiety.
Exactly.
Yeah.
And the label might not even be correct. You know, sometimes I probably, you know, because I keep my diagnosis open with my patients. It's an ever changing as I get to know them a little bit better. But yeah, it's not final. And so I may be off a little bit on something. So I always keep my mind open to, hey, what if this isn't the correct way of viewing this right now? What if I'm missing something? And then also, I never want to take power away from the person, the individual.
Because when you label them, it takes power away. Yeah.
Yes, because people need to always realize the medication, for example. I don't want people to think that the medication is what is fixing them. Because
the
then
medication
they
is not
think
fixing them. Yeah.
No, it's a tool in their hands that they're using, but it's just a small fraction. As people start to feel a little bit better, they start doing things more. So they start activating your brain. The chemicals the neurotransmitters that are changed in your brain because of some of these medications, you're talking about one or two of them changing. When people do something and have certain experiences and different stuff, they can stimulate hundreds of transmitters in their brain. And so I think we do a disservice when we take the power away from the patient. And also with that, the patient needs to have responsibility. You know, it's okay that if you do something that maybe causes your mental wellness to decline, it's okay to take responsibility and say, hey, I'm probably not trying everything that could help strengthen my mental wellness.
Wow, thank you so much. I know we're running out of time, but we have, I think we have like three more questions.
Yeah, and I'm fine. What time did we start? What time do you like to keep these? Because I literally could talk for 30 hours.
No, you're good. I was just making sure. Well, I forgot to start a timer, but I'm just using the hour mark as my mark. Maybe we'll go on for
okay, because I think we started. We probably started 15 minutes late.
Oh, okay, we'll go 15, 20 more minutes, and then I'll let you go. I just want to say the reason why I'm so aware of time here in my part, in regards to Roman, for our listeners, Roman again is a psychiatric. Is that what you said?
Yep, psychiatric physician assistant.
Yeah, psychiatric PA, and he does this for a living, so he gets paid to do this. And I just want to say that for all our listeners and people watching, he's doing this for free. I'm just trying to be respectful of his time.
Oh, yeah, no, not at all. This is actually, I I'm stepping out and starting to do this. So it's funny that right as you're interviewing me, I'm actually about to start my own podcast, so that I can create an environment that people can learn from, because I'm just not reaching enough people. I was telling you the other day that I see maybe, I don't know, somewhere between 300 and 500 people that I take care of right now. And you think of how many millions, billions of people need help with their mental and physical wellness. And so I got to do something more to get it out to more people. And so this is how it happens. It's not Roman Madsen teaching people. It's Kepu creating a platform where you can bring people in, and people that maybe weren't going to get into a healthcare provider or find the right person to be on their team now might, because they know Kepu and they learn through you. The best person to be teaching mental wellness is Kepu to certain individuals. And through bringing me on and different things, sometimes lots of people are diving into this mental health realm. And I think sometimes professionals almost look at it as, hey, they don't have any education, they didn't do this. And it's like, whoa, what are we trying to do here? Are we trying to help people, or are we trying to make the focus, or are we trying to make the focus where it's like, no, only Roman can help people because I got my education, and no, it's about getting the help to the people. It's not about who provides the help, or it's about making sure that us as a family, this family, human family, yes, we take care of each other. It can be a win-win. If more people are talking about mental wellness, more people are going to need our help to help them steer in the right direction. So it's not a scarcity mindset. It's like, the more people that get educated on mental wellness, the more we can help each other and make sure that we have a lot more help being provided, and not just 300 or 500 people being able to work with me. And so that's what I'm also trying to figure out, because I've created a program for people that is all encompassing and makes it so I can teach people how to fish, and they don't need me. I don't want people to need me. I don't want people to have to come back and see me and need me for every life choice they have. And no, I want to teach Kepu how you have everything that you need. You just have to discover it, ask yourself questions, and figure out how to create your life and do those things. But you doing them your way and being your best self, that's how you're going to thrive, not Roman's way, not doing something how I tell you to do it. That's not it. And so when I first came out with that program, I called it, I've been working on it for years, and I called it the Roman effect. And I was like, dude, this is so stupid. Why am I calling it Roman effect? Like, then it's like the focus is on me. That might as well be some pill or something. It's like, no. I need to come up with a name for it so people realize that it's them that's affecting their mental wellness, that they use this program, but it's all them. It's not Roman. And I want to get it in a way that I can teach people to teach other people, so that it's not just me delivering the help, but I can help tons of people help other people. So then we can start reaching millions of people, so that we're getting millions of people.
Creating a culture of like educating each other in mental health.
Realizing that people can get better, not just from coming and seeing one individual, or taking the right medication, or doing the right thing in order to, or doing the right diet, or doing the right physical exercise to get the best results. It's like, no, there's so much out there, but
it's too complex.
You're gonna know exactly what you need, and how to build your body up with nutrition, what type of movement you need in your body, and how to strengthen your health mentally. You specifically are going to do it in such a unique way compared to, say, me, for example. It's so different.
It's funny that you say that, because you're like now the fourth person. I've talked to 3 people that do like 2 of them do bodybuilding. One's a physical trainer. And they all talk about that, because people ask them like, what kind of diet should I do? What kind of food should I eat? And exercises, and they all keep saying, and you're like the fourth witness to this, for a lot of listeners, they're saying like at the end of the day, everybody's different. And obviously it's true, every mind is different, and you got to find out what works for you. Like the last guy I talked to, and that's next week's episode, you're going to be the week after him, is that he said, I tried 10 different diets. And throughout the whole thing, like all of them failed, but he realized, first of all, that the diets were for Americans, Caucasians, right? And he's a Polynesian. Like at 6'2", 230, he was told that he was obese, but he was like, I'm in my best form ever as an athlete. He's a rugby player, right? And now he's doing bodybuilding.
I was going to say, when you gave me those stats, I was like, man, I bet you that's a mean machine right there.
Yeah, he's really good athlete, and he's played every sport. But it just keeps just goes to say what you were talking about. Like at the end of the day, you are your boss, you are your best doctor, therapist. Yes. When you get to that mindset of like, all right, what do I need to do to thrive, as you would say. And with that, that's a great segue. Pat myself in the back. That's okay. To these things here. One of the questions, I asked these last two questions. Two of the questions are this. Can mental illness be passed down through genetics? And I guess let's go with that. And then I think the other one's kind of different.
Great question. Because we're trying to understand, and a lot of times that's being asked because people are thinking, why am I dealing with anxiety? And Roman seems like the most kickback person ever and doesn't deal with anxiety much at all. So they're thinking like, did I create this somehow, or was this like passed on? And I noticed my parents kind of similarities. Yes. The answer is yes. Genetics can play a part in it. A lot of things play a part in it. Let me try to just tell you, again, nothing is black and white ever. And so genetics part, your environment and what you grew up in, your past experience, if you're exposed to trauma, different things, if the choices of your parents actually can get passed on to you. But again, there's your diet and what you're doing in your life, life choices, career choices, relationships.
What do you expose your mind to, like social media?
Yeah. Exactly. The list could go on, and all of it plays a part. But I forget what I was reading or listening to just the other day, where they said something along the lines of, yes, genetics have a part in it. But, I was watching a medical conference on plant-based nutrition as a form of preventative medicine. And they talked about how, yes, your genes get passed on, but whether they get expressed or not, you have a role in that and what you can do. And so just because you've been predisposed to anxiety and maybe your parents pass that gene on, doesn't mean that you and your challenge with anxiety is not gonna, the result's not gonna be the same as your parents. It could be worse, it could be better, but you have so much control over it. Just because something gets passed on doesn't mean that,
it has to be expressed.
That's going to be something that, I was born with it. This is going to be mine forever. No, it's like, you were born with what, and how can you improve your quality of life with this challenge that you have? Because we all have challenges. Like some people could pick up a bottle of alcohol and guzzle it down for a month and be like, oh my gosh, I freaking hate alcohol. It's nasty. And one person could take a drink and just really gravitate towards it, and their chemistry and everything, and they're kind of predisposed to have it be a lot harder challenge for them. And so we're really good at saying like, how can people do this? And like judging sometimes, where it's like, wow, I can't believe, like, can't you just say like everything's okay and stop being scared? Like, just suck it up. Like, can you not deal with it? And then they go and they they do something super jacked up in some other way of life. And it's like, wait, we all see our strengths. And then sometimes we're really good at seeing other people's weaknesses, but we all have our own challenges. And so that's why we all need each other. And it just, I think it's really important to realize that yes, genetics does have a part in it. And someone dealing with anxiety, it's not black and white. Just because one person has anxiety doesn't mean that they're dealing with anxiety in the same way as someone else. You can have degrees of anxiety and depression. And just because something worked for one person doesn't mean it's going to work perfectly for the other person, because it's very complex and it's not black and white. Hope that answered the question.
Oh yeah, that makes sense. Last two. This one, I guess maybe you can answer fast, kind. Say, there was asked, maybe discuss why people, when they go to seek help, have the urge to lie about it.
Because they're not comfortable with the person that they're talking to. If you don't feel like someone's listening to you, if you don't feel like the person genuinely is there to help you, to be vulnerable, it takes a lot of courage. And to open up and get personal, you do that with friends, you do that with family, you do that with people you trust. And just because someone's a medical professional, it doesn't mean people easily trust them or should. Sorry, I'm just going to be flat out open about it. And so I think people often lie because they are maybe scared. They're not comfortable, and maybe they're scared of the results of that. Like oftentimes my patients, and I know oftentimes people lie to me as well. I'm not oblivious, but oftentimes my patients tell me every single drug that they're using, prescribed or recreational, because I explain to them, that in order to best treat them, I need to know everything. And I love my profession because when I talk outside of and I get personal information, I don't even have to talk to my wife about it. And I don't even feel bad about it because medically, or basically by law, I have to keep hush hush about it legally. Sorry, that's what I was looking for. Thanks. Legally, I have to keep hush hush about it. So I think some people, and I remind them of that, because then they're like, wait, I can tell Roman anything. And if he told anyone else about it, like I could come after him and sue him. So they're like, wait, he's bound by law. And so I remind people of that, because I don't want to talk to anyone about anyone else's thing. I don't want to get caught up in gossip and things like that. And so I love it too. It's like, yeah, they just told me something, but like that's between me and them. And I don't ever have to feel guilty unless I need to, bring other people in to help, and maybe there's suicidal thoughts and different things, and maybe family members need to know and different things. But first I work with the patient and say, hey, I think some other people should be aware of this. And 9 times out of 10, I don't ever have to do anything without the patient being the one to help me accomplish that.
Yeah, that's awesome. And you said you take care of about 300, 500 people. Yeah.
Yeah, that would be my guess.
Yeah. Okay, last question, and I'll let you go. Let you be with your family. Enjoy Hawaii. What are any advice for coping with anxiety attacks and how to calm down, how to prevent? Tips.
Yes, learn about your sympathetic nervous system. So everyone listening to this, write down sympathetic nervous system, and basically our sympathetic nervous system is to protect us in a fight or flight type situation. When our brain perceives danger, it kicks on a panic attack. All of us. If Kepu and Roman thought all this time they didn't deal with anxiety at all, we can have anxiety. It's built into our system and we want it. And so a perfect example is when you're public speaking, because I feel like a lot of people, public speaking makes the sympathetic nervous system run at least a little bit for everyone, especially as they first start doing it, because your brain's perceiving a dangerous situation. And it kicks on, your heart starts racing, adrenaline releases, your lungs expand, a number of different things. But you don't want to hate the anxiety. You don't want to fear the sympathetic nervous system kicking on. You don't want to fear a panic attack. It's not bad. In fact, it's very natural and our bodies can handle it. And thank goodness they can, because that's what prepares us and makes us a little bit stronger to run a little faster, climb faster, yell louder, get more oxygen, more blood supply, and be able to fight away the danger. But when you're public speaking, or say you're walking into a grocery store, some people's brains are perceiving that as a dangerous situation. And the
Like
sympathetic
agoraphobia.
nervous system, yeah, like agoraphobia and different things. Yeah. Yes, exactly. Just leaving the house is perceived as danger to them. And so their sympathetic nervous system. So what do? You have to communicate to your brain that this is not the right time to kick on your sympathetic nervous system. You're not in a dangerous situation. That's where coping skills come in. We could spend hours talking about coping skills, but let me give you just a few. Deep breathing, everyone throws it out there. And it's like, people are like, I tried doing a couple deep breaths and it's like not working. That's only one way, but the reason why, and oftentimes when we understand why we do something as treatment or a coping skill, they are able to understand it better, and it gives them a little bit more motivation to keep doing it, because they're like, oh, I see the science behind this. So when you're running from a grizzly bear, or let's use an example being out here in Hawaii. If all of a sudden I'm out at, say, Turtle Bay or Sunset surfing, and I go on small days because I'm just a haole and not experienced. But let's say all of a sudden it gets bigger than I'm comfortable with. And all of a sudden it's huge and I'm out there and it's like, oh man, like these waves are massive. My sympathetic nervous system starts kicking on. All of a sudden I start breathing faster and I'm like, these waves are going to kill me. Like I got to get in or I am going to be just crushed. And so everything is telling my brain that I'm in danger, and for good reason. I want to paddle faster. I want to get the freak out of there as quick as I can. And so I actually kind of enjoy my sympathetic nervous system kicking on there. But if I'm on the beach on a lazy day, crystal clear, it's flat, and it's basically like you're at the lake, I'm relaxed. My brain is not, I'm breathing nice and slow. There's so many different things that I'm communicating to my brain that the parasympathetic nervous system is what we should use most of the time. Just the autopilot, you're relaxed. When I am slow breathing like that, that is what I need to be doing when I want to turn my sympathetic nervous system off. Because if I send a signal of slow breaths, a big inhalation and a slow exhalation, that is sending a signal to my brain. Wait, Roman's breathing slow. He's not in danger. Why would he be breathing slow if he's in danger? And then it actually communicates to my heart, and my heart rate slows down. And then the heart sends another signal to your brain, and it's like, wait, Roman's heart, because when the lungs slow down, it sends a signal, the heart slows down, sends a signal to the brain, and then the brain's like, wait, his heart's slowing down, his breathing. I wonder if he's not in a dangerous situation. And then you can use your mind, and you can do a number of other things. You can do certain things to bring you to the moment, but I could go on and on. The main goal, though, is to communicate with your brain that you're not in a dangerous situation. When it's specific phobias, it's working in that moment when you have that anxiety to turn it off and not avoid it. Because if we avoid those things that make us anxious, it actually reinforces that the sympathetic nervous system should kick on, because it is a dangerous
and then
situation.
it becomes a feedback. And
exactly. And so doing these type of things over a long period of time, say 30 days or longer, then your brain actually changes through neuroplasticity, and you actually treat the anxiety and not band-aid it up. That's why there's a lot of concern and a lot of problems with benzodiazepines, Xanax, Klonopin, quick-acting medication that just takes it all away. It does the exact same thing as avoidance. If you get anxious and you take a pill real quick and then it calms it down, it all of a sudden tells your brain that was a dangerous situation, but you got relief. And so whatever that situation was, you avoided and you use that. And so that's a whole topic in and of itself. But that's the biggest thing that I would do. I don't know if it's all right to share, but I would recommend to everyone to watch Therapy in a Nutshell YouTube channel. And it's called, the YouTube video is called Rewiring the Anxious Brain. And it's a therapist. Her name's Emma McAdam, but she does a wonderful job explaining some of these things. And so if you were to hop over to her YouTube, I would recommend the first video on rewiring the anxious brain, and then the channel is Therapy in a Nutshell. So take a look at that, and that would be an amazing tool for you guys to look over and really learn.
Awesome. Thank you so much. Thank you, Roman, for sharing. Man, this is a wealth of knowledge, and I'm already thinking like what I'll have to do is like cut up our interview into shorter versions, and address it with each title of the questions, just so like people can appreciate it better. I'll post the full thing, but at the same time, I'm going to post like shorter videos with the answer to the question, because you've just like, I love your laid back attitude, and I love the vibe that we've had, that it's we're able to share and like address these questions. I think we're going to help so many people with this, and I'm just grateful for you for coming on.
Yeah. So work harder, man. Make sure you get it out to more people, man. Your message needs to be heard. You're going to be interviewing amazing people. So if you guys are listening to this, make this big with Kepu, because we're a big family. And so the podcasts like this is amazing learning that's done. I learn so much when I come on, and people through their comments and everything. So really, guys, if you think this is good, then just know sharing it with other people, that's you helping other people. So share this, make sure people hear this message about mental wellness, and make sure you do whatever you can to get help yourself, or to help other people find the right help. Because more people need to get the help that they need.
And thank you, Roman. Thank you, everyone, for listening. We're so grateful to have Roman. And hopefully, maybe sometime in the future, we'll get a second follow-up if we have more questions, because I know we're going to get a bunch of comments.
I would love that. I would love that, Kevin.